All right, welcome back to Stopping the Who. More really great news when it comes to the COVID-19 situation. This from the Defender, medical warfare. Yep, doctors who question COVID shots promoted ivermectin lose certification. This is just incredible that this is happening to these guys. So there they are, the two doctors who spoke out about vaccines and alternative treatments for COVID-19 received notice that their medical certifications were revoked, while another doctor said her certification was revoked without her knowledge. The American Board of Internal Medicine last week revoked the certifications of Doctors Pierre Corey and Dr. Paul Merrick following a 2-year investigation into their promotion of ivermectin and hydroxychloroquine as treatments for COVID-19, and their statements questioning the safety and efficacy of COVID-19 vaccines. According to the Washington Post, the two physicians continued to promote ivermectin, an anti-parasitic medication, as a treatment for COVID long after the medical community found it to be ineffective. Which medical community are they talking about? Corey and Merrick are co-founders of the Frontline COVID-19 Critical Care Alliance, which promotes alternative treatments for COVID-19, citing unnamed experts. As they often do, the Post claimed the FLCCC spread misinformation about the coronavirus pandemic. MedPage Today quoted an ABIM spokesperson who said the organization does not comment publicly on the reasons for the revocation of certification. However, in a summary of the ABIM's decision reviewed by the Defender, the organization stated that the doctor's conduct poses serious concerns for patient safety and undermines the trust that the public and the medical profession place in the meaning of ABIM board certification. So maybe we need a new board to do some certifications. In a press release, the FLCCC Alliance said it categorically disagrees with ABIM's decision. We believe this decision represents a dangerous shift away from the foundational principles of medical discourse and scientific debate that have historically been the bedrock of medical education associations. Paul Merrick said, the bottom line is we're disappointed because we stand up for the truth. To censor science is to censor progress. Science is based on dialogue and people can have different points of view. That is the principle of science. It's people having different points of view. No, I thought it was walking in lockstep with the medical establishment. I'm confused. We've never been in a situation before where physicians who have opposing points of view are silenced. Yeah, it's pretty horrible. It sets a really bad precedent that you can't change the status quo. And as we know in medicine, there have been very dramatic changes based on changing understandings of science. I guess science is now set in stone, right? In the FLCCC Alliance press release, Pierre Corey said, this fight is about more than just our right to speak. It's about protecting the future of healthcare. When doctors are silenced for questioning the prevailing narrative, we all lose. Notice this is happening across society, whether it's health or politics, criminal justice. It's just so many different areas where warfare, lawfare is happening. Corey and Merrick participated in an ABIM hearing in May, but internist Dr. Meryl Nass, founder of Door to Freedom, told the Defender that ABIM revoked her certification without her knowledge. Nass said she was blindsided by ABIM's decision to revoke her license, which she said she found out only when she searched for herself in the organization's database of certified physicians. So she didn't even know her license had been revoked. After the Maine Medical Board suspended my license illegally, even though none of my alleged transgressions met the statutory requirement for an immediate suspension, the board later found me guilty of things I had not done and continued the suspension. All of this with never a single patient complaint. Let's highlight that. No patient complaints. Now I learn by chance that the ABIM has suspended me without even informing me I was even under an investigation, which is illegal according to the ABIM's own process. Dr. Peter McCullough also faced similar difficulties with the ABIM over his positions on COVID-19 vaccines and treatments. According to MedPage Today, ABIM revoked his certifications in 2022, although as of today, they do list him as certified. McCullough told the Defender the ABIM is violating principles of equal protection, due process, rules of evidence, and has gone ex post facto to find reasons to attack qualified ABIM certified doctors who innovated and saved lives early in the pandemic. We wouldn't want people's lives to be saved, would we? Corey and Merrick held ABIM certifications in internal and critical care medicine, while Corey was also certified in pulmonary disease, according to MedPage Today. They were initially notified about the risk of losing their certification in May of 2022. Last year, ABIM's Credentials and Certification Committee recommended the revocation of their certification for disseminating false or inaccurate medical information. A hearing followed in May. According to the FLCCC Alliance's press release, Corey and Merrick tirelessly defended their positions. However, despite presenting over 170 references in a detailed 60-page response submitted in January of 2023, the ABIM probably didn't read that, has chosen to dismiss these robust scientific contributions in favor of a narrow, consensus-driven narrative. According to the summary of ABIM's decision, Corey and Merrick's statements about the safety and efficacy of ivermectin and hydroxychloroquine as treatments for COVID-19 are false and inaccurate because they are unsupported by factual, scientifically grounded, and consensus-driven medical information. Yeah. The ABIM also addressed the doctors' positions on the COVID-19 vaccine. The doctors' statements about the purported ineffectiveness and dangers of COVID-19 vaccines are false and inaccurate because they are unsupported, get this, by factual, scientifically grounded, and consensus-driven medical information. We just keep repeating the same line, and we hope you understand that by repeating it, it becomes true. This is extensive, factual, scientifically grounded, and consensus-driven medical information demonstrating that the COVID-19 vaccines are safe and effective and lead to better health outcomes. Merrick questioned the board's assertions regarding ivermectin, hydroxychloroquine, and the vaccines. What they do is they cherry-pick articles which support their point of view and then go on to say the vaccine is safe and effective. There's overwhelming data to question this. McCullough said ABIM never updated its members on important risks such as fatal adverse events, including myocarditis, nor failing theoretical efficacy, necessitating boosters, where they skipped human testing altogether, setting a new dark milestone. ABIM is decertifying highly qualified physicians for non-clinical reasons and ignoring the evidence for early therapeutics and COVID-19 vaccine safety. According to the Washington Post, Corey maintains a license to practice medicine in California, New York, and Wisconsin, where there are no disciplinary actions listed against him. Merrick has retired and his medical license expired in 2022. Revocation of their ABIM certification effectively prevents them from practicing at large hospitals and academic institutions. Merrick and Nass outlined the difficulties of practicing medicine without certification. It doesn't affect us directly, but it affects us indirectly because we're being accused of committing offenses that are just not true. The indirect impact to our reputation, it's a slap in the face, basically, for all the hard work we've done. Accusing the ABIM of being part of the medical industrial complex, Merrick said, they seem more interested in making money than protecting physicians. You think? There have been a number of lawsuits against ABIM, so they don't have the best of reputations. But unfortunately, they are the main certification organization in the U.S., so they have enormous power and leverage. If I get my license back, a big if, without board certification, I would have great difficulty getting hospital privileges and collecting insurance reimbursements. In other words, I would be unemployable, though I could potentially work on my own if patients paid me directly, Nass said. In 2021, ABIM and the Federation of State Medical Boards collaborated to draft the statement used to discipline Nass. Nass said organizations like ABIM are engaging in medical lawfare. She said this: creating crimes that do not exist, using procedures that do not exist to try and silence people like me. What did I do wrong? I read the literature and told the truth about what it said publicly. So she goes on to say some things here that I'm not sure I can say. She goes on to say drugs can effectively treat this and prescribed. And she said, I prescribed those drugs and helped hundreds of citizens in the state of Maine. That was my crime. So there you have it. You think outside the box, pretty much in any area of public policy and in health policy these days, and you get your license suspended. So more great news. And this all comes down, by the way, from the World Health Organization, as they dictate all of their policies to these agencies in the United States, who then pass them down and create chaos and havoc for people who are just trying to stay healthy.